And good morning. I'm Dan DeRose with 19 News Now, coming to you from our digital desk. We want to have a conversation about this bug that is wandering around Northeast Ohio, making really particular small kids, infant children sick. And when people call it maybe sort of a mystery, it's not a mystery in that we don't know what it is. It's kind of a mystery in the timing, the time of year, and it is causing people to think it might be COVID. Simply because of the symptoms, but you don't have to take it from me. Let's welcome in Dr. Robert Salada. He is with University Hospital's Roe Green Center for Travel Medicine and Global Health. Dr. Salada, thanks for joining us today. How are you, sir?
Thank you. I'm glad to be here.
It's good to have you. Let's talk about para-influenza. First of all, what is para-influenza? When do we normally see it, and why now?
So it is a distinct virus that is different from both influenza, although it's called para-influenza, and COVID. It presents generally in late spring and summer. So this is not an unusual time for this to occur, although we've been seeing an increased frequency of this. And the other point to make is that in the years with the pandemic in play, we did see a shifting of certain other respiratory viruses in the summertime, and that was respiratory syncytial virus, RSV. And these symptoms of parainfluenza, RSV, influenza, and COVID can be very similar, as you suggest, and can include fever, sore throat, runny nose, and aching all over. And it cannot be distinguished easily, one virus from another, based upon the clinical manifestations. So it's important to know that this is going on. Furthermore, unlike some of the other viruses that we just spoke about, there's really no known treatment specifically for parainfluenza. And this would entail washing your hands, wearing a mask as appropriate, staying away from work or school, if that's applicable. And then, it usually runs a course of 2 to 4 days while you're still contagious, but it may take up to 7 to 10 days to completely recover. And the bottom line is that this is pretty contagious from person to person. And not only are infants and young children more often involved, but this is spilled over into the adult age groups. So we are seeing immunocompromised patients or the elderly get this. And on occasion, it could cause lower respiratory infection, that is pneumonia. That's an important point about all of this, okay? But the only way to distinguish between the different viruses is through specific testing.
Other than the specific testing, is there a major difference when you compare someone with influenza and para-influenza? Can you differentiate what maybe the different symptoms might be between the two?
Right. So from a symptom point of view, there's not a good way to distinguish. The timing of the year is important because almost always the other viruses that we've spoken about, particularly influenza, occurs during the winter time. So in that the parainfluenza is around now distinguishes it seasonally from what we see with influenza.
Very interesting. What do you want parents to know? Again, this mainly affects infants and children, but as you said, it's now shifting to older adults, people who have maybe immunocompromised problems. But what should parents be on the lookout for? And then what can they do if their child gets it? As you said, there's really no known cure. It's not like you can go out and get Tamiflu.
Right. No, Tamiflu does not work, unfortunately, for this virus. It's really a distinct type of virus. It's a little bit worse symptom-wise compared to the common cold. So that would be one thing to consider. It can occasionally cause croup or a distinct cough. And as mentioned, even in children on occasion, and more so in immunocompromised individuals or elderly. it can be associated with pneumonia as well and be quite severe in that regard. So hand washing, preventing close contact with others, wearing a mask when appropriate are all things that are important.
So do you just have to ride it out? Do you make your child as comfortable as possible? What do you have to do?
They are working on some therapies, but nothing is imminent at the moment. Yes, you'll have to ride this out, so to speak. And as I mentioned before, usually runs a total course of about 7 to 10 days in otherwise healthy children. It could be more prolonged in terms of the symptoms that we spoke about in older or immunocompromised individuals. So that's something to keep in mind additionally.
Excellent. Dr. Robert Salada with the University Hospital's Roe Green Center for Travel Medicine and Global Health. You're always a wealth of information. Thank you for joining us yet again today.
Thank you.
All right, take care, sir. Again, just a bug that's out there in Northeast Ohio. We want you to hear from the experts. You might think, oh no, my kid has COVID. As you heard from Dr. Salada, whether it's flu, para-influenza that we're seeing now, or COVID, they all have very similar symptoms. So no need to panic, but as you heard Dr. Salada say, there's no real treatment here. You kind of just have to make your children comfortable and let them ride this out for 7 to 10 days. If we have any other breaking news, we're going to bring it to you here on our digital properties. Otherwise, our 11 o'clock news gets underway in about 20 minutes on CW43, and then our noon news on Channel 19. Until then, I'm Dan DeRose with 19 News Now. Have a good afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media @Cleveland 19 News.